Hi. Um, I want to talk today about political sustainability and particular political sustainability of the current healthcare system. I was listening to a Fresh Air interview with Jonathan Cohn, who recently wrote a new book about the 10-year fight to get and keep the Affordable Care Act. And he talked about this a little bit in the sense that he mentioned all the factions that were trying to prevent anything serious from happening to the current healthcare system. And having read a lot of Uwe Reinhardt's materials over the years, and I'll put links to some of these down below. But Uwe Reinhardt and Mei Chang had talked about this concept of political sustainability of the healthcare system in America and the political sustainability of the status quo. And so I wanted to spend a little time talking about that. So off we go. I can get the slide working. So when I think of sustainability of healthcare in America, I think of several things: political sustainability, economic sustainability, and financial sustainability. And I'll get to the other ones in a little bit. But when Uwe Reinhardt was talking about political sustainability, what he was talking about was the fact that all this money and all this employment and all these factors flow into American healthcare and then flow into political coffers and campaigns and on and on and on. And we've all seen it for several decades now of making it politically sustainable. In other words, it is politically sustainable to continue the current system because so many people have so much invested in it. And therefore, overcoming the political sustainability is huge. And it's not insurmountable, but it is a big deal. And it's important to keep it in mind when you think about why people act the way they do, why politicians act the way they do, why people in the medical industry act the way they do. It's because most are trying to preserve the current system. And I just put these statistics up here just to give you an idea. Healthcare spending is 18% of GDP. We all know that. That's $3.4 trillion. 11% of the U.S. workforce is in healthcare. Healthcare is 24% of all U.S. government spending. It's 24% of non-wage compensation. It is the biggest chunk taken out of American workers' paychecks of any kind. Healthcare is 8% of consumer spending. 8% of consumer spending. That's astounding. And 1/3 of that healthcare spending goes to hospitals. You know, those friendly neighborhood places that we all count on to be there when we get sick. Many of them labeled as nonprofit, but that's for another lecture. But you get the idea. These are the largest employers in their communities generally, and so they have a lot of clout. Another reason this is so important is because of the old saying, one man's waste is another man's revenue. We look at the healthcare system generally and see huge swaths of waste. And in terms of adding value to the system, that's exactly right. There are huge segments of the medical industrial complex that add no value. They only extract money out of the system and contribute virtually nothing. The problem with that revenue is it's vast, as we talked about a second ago, $3.4 trillion a year. It's a lot of money, and that money gets translated into political donations. All that waste is coming from your community's largest employer. That waste leads to massive philanthropy, or the companies that sponsor the sports teams. Look around your city and look at the biggest buildings in town and see who they belong to. I know in my town, two of the biggest buildings in town are owned by health plans, and they have big prominent, logos up there. They have big prominent logos on the NFL team, the NHL team, the Major League Baseball team, you name it. The college teams, their logos are everywhere. That is a lot of clout, a lot of clout. And again, 11% of people work in healthcare. That's a lot of people. Wendell Potter said that health insurers have been successful at two things: making money and getting the American public to believe they're essential. They spend a lot of money making us believe that they're essential, and they earn a lot of money by making us think they're essential. Wendell's obviously a crusader in his own right, and I'll leave that there, but it's a very important thing. It is critical to understand how the public views these companies, because so much money has been spent making health insurers and pharmaceutical companies and so on appear to be adding value to the system, when if they are adding value, it's marginal value at best. Again, a topic for another day, but the point is it contributes to the political sustainability of the system. Going against the common wisdom is difficult. I bring this up just because I think it's important, because this is from an article about bullshit jobs. Bullshit jobs and the yoke of managerial feudalism. It's an interview with an author of a book, David Graeber, about bullshit jobs. And I read this and I think you'll know what I'm talking about. What is a bullshit job? A bullshit job is one that even the person doing it secretly believes need not or should not exist. That if that job, or even the whole industry, were to vanish, either it would make no difference to anyone, or the world might even be a slightly better place. Something like 37 to 40% of workers, according to surveys, say that their jobs make no difference. I will only add on to that if you've ever read Elizabeth Rosenthal's American Sickness about the medical industrial complex, if you read that with this in mind, the bullshit jobs in mind, there's definitely synergy there in thinking about the jobs that are in the medical industrial complex that either add value or don't. If you read that book, you will be enraged by how many jobs don't add value and only extract money. When we talk about the sustainability of the healthcare system, usually from the left, we're talking about economic sustainability, and I've reproduced the exact same figures that I gave you on the earlier slide. This is not economically sustainable. These numbers are getting worse, not better. And it is economically unsustainable and yet politically massively sustainable. Something's got to give at some point. The smart money right now is on the political sustainability, but I'm hoping that if we can persuade enough people that we should do universal health care, we can break down the political sustainability. The last thing I wanted to talk about is financial sustainability. 5% of Americans accounted for half of healthcare spending. And why is that important? It's important because if you're in that 5%, you're in big trouble. Unless you're very wealthy, you're going to have major financial hardship. Expenditures are high and variable for those with the poorest health. Healthcare spending per privately insured person is 3 times higher in some parts of the country than others. So depending on the lottery of where you were born and where you live, you might be spending far more than your cousin who lives somewhere else. Half of all money raised in GoFundMe is for medical expenses. It is astounding how we ration care in America and how cruel we can be to each other by not providing care. Uwe Reinhardt used to say America is capable of unfathomable generosity and unfathomable cruelty at the same time. We will have a GoFundMe campaign and raise, millions of dollars for the cute kid that needs a transplant, and yet we will let 10% of the population essentially live in a third world country of healthcare because of our rugged individualism and things that I've talked about in other lectures. But it's important to think about the financial sustainability, because that is somewhere where we might be able to get some empathy from people. Everybody knows somebody that's suffered a major illness, and if you ask them about it and what it's done to them financially, it's a hardship, and it's a big hardship. And no other country in the world does that to their citizens. And yet, again, with our cruelty, and sometimes it's unsuspected or unknown cruelty that this is going on, and we're not aware of it. Sometimes it's very well known. When the crowd cheers when they ask about a person without insurance, of what should become of him. Should we treat him and pay for it, or let him die? And when the crowd cheers, let him die. That's kind of rough. But if used properly, we should be able to take that and make some empathy, because everybody knows somebody who's had an unexpected illness and had a financial hardship from it. I won't belabor that point. I just wanted to give you this little final statistics here because I think it's so important, and it makes the point about how random this can be. And you can be, living your life, middle-class life, doing fine, and boom, you get the C word, you get cancer. A study done in 2018 in the American Journal of Medicine showed that Americans newly diagnosed with cancer at year 2 after they were diagnosed, almost 43% had depleted their entire life's assets. Average losses were $92,000. Only 7.9% of these were uninsured. So these were insured people that were just devastated by a cancer diagnosis. Cancer is one of the leading causes of death. Heart disease is not that different financially, I am sure. I don't know that there's been any actual studies, but clearly the same idea, right? Massive expenditure, massive hospital bills, massive doctor visits, massive pharmaceutical, technology, you name it. It all goes together. Getting sick is devastating both physically and emotionally and financially. A friend of mine recently pointed out to me that one of the reasons healthcare reform is so hard is that there's an undercurrent of that puritanical streak that makes us not want to help the undeserving. But really what's going on in healthcare, and healthcare insurance in particular, is it's not about the deserving and the undeserving. It's about the sick and the well. The well subsidize the sick. And as the saying goes, there but for the grace of God go I. It's something that we can use to create some empathy, to try to get people to think differently about universal health care. I throw this up just because on top of all the financial toxicity and the economic unsustainability, there is the cruelty in the system that Professor Reinhardt talks about. The 1,000 injuries of Fortunato I had borne as best I could. We routinely subject people to small cruelties and large cruelties. The small cruelties are the prior authorization process and delaying care. The major cruelties are unaffordable medications and forcing people to choose between medications and rent and food. The examples are endless, and again, a topic for another day. But the cruelty in the system is important, and I think it's important that we spend some time highlighting it. So I founded Moral Healthcare with the idea of using cognitive science to try to move the debate on universal health care. And I'm just going to give you my elevator pitch because I think it's important to see how I sort of frame all this. So I think we must convince people that universal health care is the right thing to do before any movement can take place. We must learn to highlight the cruelty in the U.S. healthcare system. We must be able to show that it does not have to be this way. We must call out the malefactors, even the unwitting ones, the people that are in the bullshit jobs, who are those who are fighting change and continue to fight change, and those who are just along for the ride. Most importantly, we must use cognitive science to figure out how to win over healthcare professionals first, in my opinion, and then the public. And until we do all of this, no matter how wonderful our policy prescription is, real change is not going to happen. So I have a couple other lectures up here on YouTube, specifically talking about how I came to this, and it's in a lecture called 3 Books, and another piece I just put up most recently, putting together all my thoughts on how to apply cognitive science to healthcare reform. And it's long, 50 minutes, but it contains a lot of material, and it explains a lot of the things, the reasons why I posted this lecture. So I hope you'll watch it, and as they say on YouTube, subscribe and like, and see if we can get a movement going. Thank you. Have a good day.